Pemiscot Memorial Health System is committed to provide an organized system of healthcare services to all persons within our service area without regard to age, sex, race, color, national origin, creed, financial status, physical or mental challenge. Pemiscot Memorial Health System strives to work in collaboration with local, state, and federal organizations to ensure access to primary care for all residents with a special emphasis on preventative health and wellness. We diligently work to maintain our financial strength in order to remain a prominent provider of medical services for the region.
From the age of 5, I wanted to be a doctor. I really couldn't tell you why. I was just fascinated with medicine, and I loved my doctor's visits, and from day one I wanted to be a doctor, and my grandpa always told me girls couldn't be doctors, and I think that always kind of pushed me a little further, and I never even considered another profession. I work long hours. I work 7 days a week a lot of time, but that's what I feel like I was meant to do. That's what I've always wanted to do. Since I was 5 years old, that was the practice that I wanted, and I don't want a big city practice. I don't want a 9 to 5. I like providing care 7 days a week in the hospital, in the clinic. When they're in the hospital, when they're here, it doesn't matter. I want to take care of them wherever they're sick, not just in the clinic setting, and that's where I think where a lot of medicine is going now. You take care of them in one setting and then you pass them off to somebody else, and that's not the kind of medicine I want to practice. So I like the rural setting, and I think this is where I'm meant to be. In a small community like this, funding is very difficult. It's hard to attract people. It's hard to keep people. The hospital itself, we're understaffed. We don't have enough nursing. More staff in general, just more medical providers in this area. A new patient comes into my office, makes an appointment. First of all, they will get a 30-minute visit. We will sit and talk about their past history, what's going on now, what their concerns are. I will see them anywhere from every month to every 3 months. From here on out, they know that if they're ill, if they need anything, they can call me and they will be seen within the next day or two. I would love to have more specialists in the community. Right now we have some specialists that come from other hospitals, maybe a day every couple weeks or a day a month, and I would love to have maybe a cardiologist or a neurologist or an endocrinologist so my patients don't have to travel as far. I think that would be very successful. We now have a mammogram that comes once a month. That was a service that was missing for quite a while, and I think that's been a very positive thing in our community to bring services back into the area. We have a lot of patients that can't travel, and getting as much as we can here locally to where they don't have to leave the county is very important.
Well, Dr. Erica is a real fine doctor, I think. From a 1 to 10, I think she's about 11. And I've been real sick. I'm 85, and she takes care of me. And back in November, I had number 3 heart attack, and she saved my life. And so I've been coming to her for about 3 or 4 years. I think she's a wonderful doctor. And the office is nice too. It's always clean, neat. And the girls at the office are always nice when I call them and need something.
Our convenient care clinic is open 8 a.m. to 8 p.m. and has weekend hours. You can walk right in and receive prompt medical attention with minimal wait times, affordable service, and ultimate flexibility. Our convenient care is a smart, sensible choice for your healthcare needs.